Hey everyone, and welcome back to another video. In today's video, we're going to explore another climbing technique, the drop knee. We'll take a look at what it is, the anatomy involved, potential injuries, and some exercises that can help prevent these injuries. A drop knee is a climbing technique that allows for a more stable base of support while staying close to the wall to reach for the next hold. It involves internal rotation of the hip and the knee while pushing backwards into a foothold. It is a more advanced technique in climbing, and it utilizes the strength of the hip extensors to push and maneuver in a more stable and controlled manner. Let's take a closer look at the movement and what forces are going through the body. To perform a drop knee, climbers will twist their hip towards the wall and drop their knee down, rotating over their foot. This places the hip and knee into almost end of range internal rotation. This creates a torsional force through the knee, and when loaded, a lot of strain is placed into the medial aspect of the knee. The knee is primarily a hinge joint, with its main actions being flexion and extension, or bending and straightening. It does have a small amount of range for rotation, but this is quite limited when compared to the amount for bending and straightening. Considering this load through the joint, the structures that are most at risk when performing a drop knee would be the medial collateral ligament, or the MCL, and the meniscus due to the rotational force. The MCL sits on the medial or the inside border of the knee joint and helps to prevent excessive valgus strain. This just means force on the knee that comes from the outside towards the inside, or from lateral to medial. Ligaments are structures that attach from bone to bone, and in this case, the shin bone or the tibia to the thigh bone or the femur, and are commonly known as passive structures as they can perform their job of stability without any conscious input. When a significant valgus load is placed on the knee, the MCL is stretched, and in some cases, when the load is excessive, the MCL can tear or rupture. The meniscus is another structure that can be injured in a rotated position, especially when the knee is at end of range flexion or extension. It is a cartilage that sits within the knee joint and acts as a cushion between the thigh bone and the shin bone. There are two menisci in the knee, the medial and lateral meniscus. A meniscus tear can often result in loss of range of the knee, as well as swelling and clicking, and can sometimes need surgery to make a full recovery. So, how can you minimize the risk of these injuries? When we think about the stability within any joint, there are three aspects that can contribute to joint stability. These are passive structures, such as the MCL, active structures, which are your muscles or tendons, and your neuromuscular control. In other words, your brain's ability to activate the right muscles and control a certain movement or position. With this in mind, we can have a think about what active structures can help in a drop knee to offset the load on the MCL and the meniscus. To support the knee in a rotated position, we can train the muscles of the outer thigh, as they will help resist excessive internal rotation. Starting with banded squats. We can simulate the valgus force on the knees by using a resistance band looped over both knees. Stand with your feet at least shoulder width apart and push your knees out over your toes as you perform a squat. Make sure your knees don't collapse inwards as you go down and up. Aim to squat down to at least the 90-degree mark, as this is where your knee is the most loaded and closest to the position it will be in a drop knee. This will work a whole group of muscles on your outer thigh and up to your hip that help perform external rotation, which is the opposite direction of force to a drop knee. Perform 15 reps for 3 sets. To progress the difficulty of this exercise, we can add on weights or use a thicker resistance band to increase the valgus load on your knees. Our next exercise targets more of the hip thrust strength, which is used in a drop knee to stabilize and move the body. Once again, using a resistance band, we can perform a banded bridge. Start on your back with both knees bent up and a resistance band looped over your knees again. The idea is very similar to the banded squats, where we want to resist the valgus force created by the resistance band as we engage our hip and knee muscles. Push down into your heels and engage your hamstrings and glutes to lift up. Engage your outer hip and thighs to push out against the band. Then slowly lower back down. Once again, you can progress the difficulty of this exercise by adding on weights or by using a thicker resistance band. A more difficult exercise for the knee to perform would be a banded backwards lunge. Start by tying a band to something stable and then loop it over one knee. Step backwards with the other leg, bending both knees to drop down into a lunge. Stop just before the back knee touches the ground and then come back up. Make sure your front knee stays directly over your toes as you bend down and is not pulled inwards by the band. You can step your foot back towards the starting position and then repeat. Aim for 10 repetitions for 3 sets and slowly build this up towards 20 repetitions. Our final exercise for this video on drop knees is to do banded crab walks. This is done by looping a band once again around your knees, dropping into a mini squat with your knees and feet at least shoulder width apart. From there, pick one leg to move sideways, increasing the tension on the band, and then step in with the other foot back to the starting width. You will want to maintain the tension on the band throughout the whole exercise. Once again, your aim is to push your knees out against the force of the band as you perform the crab walk. Take 10 steps one way and then come back, leading with the opposite leg. You might have noticed that all the exercises target muscles that externally rotate the leg rather than internally rotate, which is the motion the drop knee goes in towards. This is to train the opposite group of muscles, which will help control how much internal rotation occurs during a drop knee and not let the force of the movement excessively load one side of the knee. The exercises shown in this video challenge the external rotators isometrically while creating a similar valgus force to a drop knee position. In saying this, it is important to practice this move on the wall and learn how it feels for your knee to perform, and to be aware of any strain or fatigue building up on the inside portion of your knee. This would be a sign that there is too much load going through the knee and you would need to rest the knee. If you have injured your knee, then please seek professional medical help to get assessed and treated appropriately. As always, if you've enjoyed this video or found the information in this video helpful, please hit the like button. And if you like these physio analysis videos, say that 3 times really quickly, leave me a comment down below on what you'd like to see me analyze next. Subscribe to the channel to see more videos just like this one. Thank you so much for watching till the end, and if you are enjoying my content, maybe you'd like to check out this video next.